Welcome, everyone, to the South Asian Public Health Association Spotlight Series, the platform where we spotlight the remarkable journeys and career trajectories of trailblazers in public health, with a special emphasis on the South Asian community. We're your hosts, Samira, President of the South Asian Public Health Association, also known as SAFA, and Mushira, the Events Planning and Professional Development Committee co-chair for SAFA. SAFA is an organization dedicated to advancing the health and well-being of South Asians in the U.S. and the communities in which they live, and has been instrumental in fostering collaboration, advocacy, and research to address health disparities and promote equitable health outcomes. Today marks a special occasion as we continue a series of interviews commemorating the 25th anniversary of SAFA. As your hosts, we are thrilled to delve into captivating conversations with influential figures in public health. Stay tuned for inspiring stories, insightful discussions, and a closer look at the impactful work of SAFA over the past 25 years. Learn more about us and explore the wealth of resources we offer at www.safa.org. For our 10th episode, we're honored to have Dr. Shilpa Patel with us. Shilpa was the co-chair and or co-president of SAFA from 2004 to 2006, and also an author of one of the chapters of SAFA's monumental brown paper. She brings over 24 years of public health experience, including designing and implementing global and domestic studies with a focus on HIV prevention and its intersection with violence. She has held key leadership roles at the CDC, served as a country advisor for the DREAMS initiative through PEPFAR, and is currently an adjunct professor at Emory University Rollins School of Public Health in Atlanta, Georgia. Shilpa, welcome to the SAFA Spotlight Series. We're thrilled to have you here with us today. As this is our first podcast following the 2024 elections, I'm sure our audience is eager to hear your valuable insights on the current state and future of public health. So welcome. Would you be able to just, start us off with sharing a brief overview of your career journey in public health and what initially motivated you to focus on HIV prevention and global health?
Sure. So I'll start off with what you just led the conversation, the segue. It's a pleasure to meet both you, Samira and Mashira. I'm glad to be here, and it's been wonderful to take stock in how far I have come, and hopefully can share some insights of my journey, and maybe that would be beneficial to some of your listeners out there. A couple of things. I just wanted to acknowledge where we are. We're, post-election 2024. It's feeling particularly heavy, I think, for folks that are in public health, practitioners and researchers. And I think, we're in November and December. This is typically a heavy time for a lot of people. We're heading into the holiday season. And I think we should just honor that. I think there's so many different layers that I think we're being besieged with. We have a lot of global turmoil. So I just wanted to acknowledge that as we begin this conversation, because I think each of us is grappling with different, you know, just feelings and um, burdens and heaviness. And I think it's okay to just say it for what it is and knowing that it is a hard time. And I think there's uncertainty or concerns around uncertainty around funding and such. So I think we can say that and share that and honor that. And then also to acknowledge that we're an incredibly resilient and resourceful people as South Asians and as public health researchers and practitioners. And I say this because public health is extremely multidisciplinary. And just by virtue of being disciplinary, multidisciplinary, we're incredibly creative people. And we also are used to riding the waves of funding. There have been times where funding has been tight and we found a way forward. And I think public health is also where science, purpose, and passion kind of come together beautifully. And I think once we have those key tenets in place, I think we'll always be able to move forward in our respective fields. So I think we can hold both of those truths, that it is a particularly heavy time for so many reasons, and also that we're an incredibly resourceful group of people. And I trust that we will continue the charge, do what we need to do, and pursue our work and craft. So you asked me about my public health journey, and this was so fun because I don't think I have taken the time to take stock of why.
Mm-hmm.
I kind of maybe look at it in chunks, but not really what the story is. So thank you for giving me the opportunity to share my story. So I was a kid of the 80s and 90s, as many of your other speakers have been. And HIV/AIDS was a big part of our experience growing up. I remember in the 80s, at that time, this is before information was at your fingertips through the internet. So our information was through the news, through TV, and through newspapers and conversations we had in the classroom. And I just remember the word AIDS on the screen and just the gravity of what was being said. And I didn't quite fully understand it, but I understood something we were grappling with as a country. So that was certainly the backdrop. And then years later, as I was going through school, it certainly entered health education classes, biology, and it was the only disease that actually came into play. We weren't talking about diabetes prevention. We weren't talking about other health issues, but we were certainly talking about HIV/AIDS. So it was definitely part of our vernacular. And then I went off to college. I'm going to share these things, and nothing is quite linear. I think a lot of our paths have not been linear, but we can connect the dots. But I remember early in college, I read this book called "And the Band Played On," and it was a book by Randy Schultz. And it chronicles the spread of HIV in America, but it also talks about the profound social implications, the slow federal response. And then it depicts the CDC response to HIV and understanding what the outbreak was, how HIV was transmitted. And of course, at that time, it was called AIDS. So AIDS was part of the vernacular at the time. It later became HIV. But it was in those moments that I realized that this was so much bigger than we were. And this was going to be kind of the social issue of our time. It's just reading that book. And then there was simultaneously, I had that experience. And my mom is from Southern Africa, from Zambia. So we have a lot of family in Southern Africa. And we were just hearing the absolute devastation in communities in Southern Africa. And it spoke very personally to me. I mean, certainly we had celebrities in this country, Arthur Ashe, who I adored because he played tennis and I love tennis. But all of these things were happening. And I don't think one can be the same person when you know personally and societally, there's just been this affront. And so I say that because I think those were the beginnings of my interest in domestic HIV and global HIV. It hit home kind of personally, and then academically, I think we weren't really. I don't know that we had a lot of pathways presented to us. I knew I was interested in a career of service. And I also knew I was interested in science. And I think the only pathway that I understood at that time was to either be a professor or to become a physician or a dentist. And so in that process, I just thought, okay, well, this is what I'm going to pursue. And maybe I'll become an infectious disease physician and do maybe some work abroad or globally. But then there was this course, I took a microbiome class, and the professor had this really interesting homework assignment, and it was to investigate an outbreak of some sort of bacterial infection that was caused by apple juice.
Oh, wow.
It was in that process that I learned what an epidemiological investigation was, what an outbreak response was. I didn't even have the language to describe that at that time. And that was probably in my later undergrad years, probably my junior going into my senior year.
Hmm.
And then I thought, okay, well, this is interesting. Let me look this up. So I went, back then it was the course catalog. So we went to the course catalog and I was looking at what is epidemiology and then what is public health. And at that time, there were a lot of restrictions, like you had to have 2 years of experience to be able to apply to some of these programs. So then I kind of looked further and looked at programs that didn't require that 2 year work experience. And I applied to those schools and I just kind of applied almost, it seems very blindly, but
Right.
very, little did I know. I think every little step along the way was pushing me in this direction. Again, not knowing whether I was going to still pursue medicine, but I thought, why not? Let me just explore. It's only a 2 year, 1.5 year program. So that's kind of how the story began. And I will say later, once I started my master's in public health, I began to take courses as everybody does, and it exposes you to new areas. And so I had a violence prevention course that required us to do a project to interview an organization that was doing service work. Was a domestic violence service organization. And so I learned about South Asian DV programs. I learned about Upnagar, and there was an organization in Boston. And then there was Manavi. These were some of the early
Right.
DV organizations at the time. And it really blew my mind. I thought for the first time, oh my gosh, we're seeing there's actually services for people like us. And it was the late 90s, where like, yeah, the late 90s at this time. So I, gradually these doors and these ways of thinking were opening to me. Um, and then after I left, I worked at a WIC clinic. I was a supervisor for a WIC clinic in Los Angeles. And I was still doing, that was a WIC plus clinic. So we were doing a lot of public health interventions. So
Mhm.
HIV prevention was one of those prevention interventions that we were delivering. And then from there, so I kind of always stayed tuned with HIV prevention. At the same time, there was an organization in LA called Sahara, if I'm not mistaken, and I began doing some trainings with them and then a little bit of volunteer work with them. So I kept my foot, in that door. And then I then moved on to San Francisco, where I took a job with the Asian Pacific Islander American Health Forum. So that really kind of just I would say pushed me into a whole area that I had deep passion, but is also where passion met purpose. I learned so much at that organization. I learned that you really have to have like a seat at the table. And that seat is not just in San Francisco, where the headquarters is. The seat is also in DC, and the importance of advocacy and policy. And that's also where I had the opportunity, was maybe right before that time. So sorry, I'm not talking about things sequentially,
Okay.
but it was about in the early 2000s when the brown paper came out. And Abhijit and Ushma had put out a call, and other board members put out a call for support on the brown paper. And what they had specific areas that they were looking for someone to author. And I was like, well, I'm going to give this a go. And one of the chapters was substance abuse. I didn't know anything about substance abuse. I just knew what everyone else knew. So it was a wonderful opportunity to meet them, to tap into their network, to learn about subject matter experts who were doing work in not only the South Asian community, but doing work on substance use. And that's how I ended up drafting that chapter of that paper. And that I think coincided with my work with the health forum, or the beginning
Mhm.
stages of my work at the health forum. So there was a lot of synergy at that time. Again, initially, it's not really sure, I wasn't really sure where I was going, but then over time, actively pursuing the paths that I wanted to pursue. And, some of them worked, some of them didn't. But I think the health forum really worked out for me because it can really leverage my opportunity to be the best I could as a board member for SAFA. Um, so I'm going to stop there and see if you have questions. I said a lot.
Yeah, it's
No, that was, I mean, what an inspiring and incredible journey. So thank you for sharing all of that and also for your very powerful words of wisdom that you started off with. Just a reminder to all of us that, yes, that resilience is there, right? So thank you for that. And you talked a little bit about the brown paper, but we would like to know, just going back, looking back on your years at the South Asian Public Health Association. How do you think your experience with SAFA shape your understanding of public health challenges within South Asian communities? And then how did this role shape your global public health work? Could you just elaborate on that a little bit?
Yeah, it's hard to disentangle my role at SAFA with my role at the Health Forum because they're very synergetic.
Mhm.
I would say again, that I referred to this earlier is just having a seat at the table and how important it is to carve out those seats because a seat is not necessarily going to be provided for you. No one's just going to open the door for you. I think how I was able to frame my role and why we needed a seat at the table was through data. And data, data-driven decision making is important. My role at the Health Forum was as an analyst, and so I use a lot of the census data to analyze what was going on in our communities, in our respective groups, for not just for Asian Pacific Islanders as a monolith, but respectively what was going in each of our communities, where the demographic shifts were happening in the country. And I think I was talking to Samira earlier that I'm in Atlanta now, and little did I know I was going to be in Atlanta or live in the state of Georgia. But I remember in those early years, I was seeing this huge demographic shift and this growth among South Asians, respectively, Asian Indians, Bangladeshi, Pakistani Americans who were in this area, and that increase in the early 2000s. And we continue to see that shift today. And what does that mean for our health and really advocating for health equity, and understanding and elucidating some of those health inequities? So I say that because I think that data is been a big part of justifying that seat at the table when we need to justify it. So I think SAFA, with the brown paper, that was just a groundbreaking tool, and it was what we could use to leverage and to bring attention to what was going on in our community. And I think the health forum really helped me do that because it was like, okay, well, we really need a push for disaggregation of data. And then we already had this really formal relationship with the Census Bureau, which is a federal agency. So I thought that was a wonderful pathway. And then I could use that to leverage my work at the forum, with SAFA. What we did while I was at SAFA, and maybe this segues into some other questions, but I'll pause there.
No, that's great to hear. And, I would love to learn more about just how, you were involved with the brown paper and then you and eventually took over some of the committees. You were working on the fact sheets and then eventually ended up being co-chair. So I would love to hear more about your journey on how like you got to that point. But then also shifting away from some of the work related stuff, as you reflect back on your time with SAFA, is there a specific moment or experience that stands out to you as particularly significant? Something that was just, really monumental for you and really made you, enjoy your time on SAFA's board.
I think building partnerships, with people who were in the space or peripherally in the space. I think those are our proudest moments.
Mm.
It is a volunteer board, and you all have done, let me just pause and say, you all have done remarkable work. What you have done, I've looked at what you have been able to accomplish in the last few years, and I just think it's so impressive. Just the tools that you have created, the papers that you've put out. So I will say that you have done quite a bit. But at that time, it was we were still very much at building partners, getting a seat at the table. That in in the process of advocating for Asian and Pacific Islander health, that we weren't lost in the shuffle, that we still continue to have that voice as South Asian Americans. Um, I would say what we did, with the brown paper, when I was on the board, we were considering whether we wanted to do a brown paper too.
Right.
And the amount of effort that it took to put the brown paper together, not having led the entire effort because Ushma and Abhijit and others, in that inaugural board were really led the charge. But just having produced one chapter, I knew how much of an effort it would be, particularly because we were all volunteers as well and finding the time to be able to produce that. So we thought, why don't we leverage what we have and produce fact sheets? So I led that charge to develop fact sheets, which, in that process, there's a lot of updating of information, making sure that the reading level is as such. Um, so that was quite a bit of effort. I feel like that was a contribution, that was a tangible contribution. I think some of the other pieces were not as tangible, but very important for moving the work forward and advocating for South Asian health.
Mm-hmm. That's great.
You know, as we continue to build on the amazing work that founding members, such as board members of the board, such as you have done, let's just talk about some of those critical areas of focus for SAFA moving forward, particularly in when we think about addressing health disparities or health inequities. And SAFA has been instrumental in advocating for the health of South Asian communities in the US. But in your view, looking ahead, how do we move forward and how do we address those critical areas?
So I'm going to mention a couple of areas that are more broad sweeping. And I think building coalitions, partnering with organizations, we're just stronger together, period. I think there's some amazing work that's happening globally. There's some incredible research happening in our communities in the UK. Um, how can we identify, particularly in where we are in this country? Sometimes it can feel very isolating that we're kind of doing this alone. And sometimes it's recreating work that's happening in other spaces, not necessarily here. But how can we leverage the relationships of organizations, of researchers globally? We are deeply interconnected. Many of us have our children of immigrant parents. Some of us are immigrants ourselves. So just that, what is that pathway from where the countries that we originated from, and also the work that's happening globally, but leveraging some of that. And I think there's an opportunity for that. I just read a paper a few days ago on mental health in the UK, and this group had done this work on looking at mental health indicators among Bangladeshis, Asian Indians, and Pakistanis in the UK. And I can't remember what region it was, but I thought, gosh, I would be wonderful to talk to them, to meet with them, particularly if this is the work that we're doing here. Um, but I think there's opportunities to leverage those relationships globally. So, and I would say even domestically, there's lots of opportunities to do that. And then the second thing, which I'm a big proponent of, and I was going to talk about this later, but there's an opportunity now, is data to action. It is a piece that I weave and I've in any funding opportunity that I have. And I say that is that data to action is not just dissemination through publications or fact sheets. Data to, data to action is really a very thoughtful, deliberate process where you're engaging the communities that you engaged with at the beginning of a project and throughout the project, but at the end, returning the data back to the communities in which you gather the data from, and returning it with dignity. And that is that they have a seat at the table, you're sharing the data, and then they're using that to create an action plan for their respective sectors and their communities. And I can talk about the particulars of that and how we've done it. And I know there's other people who've done it, but I think there's opportunities for us to do that or advocate for that, and advocate that. And what I mean by that is that, dissemination is not an afterthought, that we really think about that when we start a project of how we're going to share these data at the end and how are they going to be actionable. And I think just advocating for that and pushing for that, as SAFA, or as, respective practitioners and researchers, I think there's opportunity for us to do better at data to action.
Yeah, that's very important, I think, and we've been having a lot of conversations around, moving in that direction. So it's great to hear that, a lot of people are thinking along the same lines. Shifting a little bit back to some of the work experience that you've had, based on your expertise in HIV prevention and your experience with SAFA, what do you see as some of the unique challenges that South Asian communities face, specifically in HIV prevention, but also just more broadly? And then how might organizations like SAFA address some of these challenges?
Yes, it's something that I'm grappling with as well. And it's the stigmatization of sex and shame and embarrassment around it, because I feel like the topic of sex is a gateway to so many other topics, and HIV being one of them, many endpoints and outcomes.
Mhm.
But I think there's no harm to say that if there were not conversations around sex and sexuality and sexual health in our household, that it would be very normal for us not to be feel comfortable broaching those topics with our kids. And I've been in this field and I still find it hard. And I'll be the first one to say that. And I think we can be cycle breakers.
Mhm.
We don't have to do what was done to us. We know that it didn't serve us. And it's big and no harm to anybody, and no harm, no foul. They didn't know what they didn't know, our parents in our communities. But I think we have a real opportunity to make a shift.
Mhm.
And there's so many tools out there that, provide, I wouldn't say a script, but the framework to have these conversations. We know from studies that if we have open, ongoing, accurate conversations around sex and sexual health that are developmentally appropriate, that leads to better decision making around sexual health. So we know that. We know that not just in this country, but we know this globally.
Right.
And so I think that this is an area that we can maybe just focus on, is just the shame and the stigmatization and embarrassment around sex, and using that as an opportunity to talk about reproductive health and so many things that are important in life. And it's an area that I am with a 10 and 12-year-old, I am actively working on. I'm trying to flex that muscle. It's not an easy muscle to flex, even working in this space, but we can say, okay, this is where I'm at and this is where I want to go, and what are the tools to actually get us there.
Mhm.
Um, yeah, I had another point, but I think I'll stop there.
Thank you.
No, absolutely. And the stigma definitely is certainly a critical barrier, right? And I liked how you talked about flexing those muscles, breaking the cycle, definitely. But let's talk a little bit about your on a global scale then as a country advisor for the Dreams Initiative. You work to reduce HIV rates among adolescent girls and young women in high burden countries. So could you please discuss the challenges or successes you encountered in this role, and perhaps a little bit about the strategies that proved most effective?
Yeah, so the Dreams Park program is under PEPFAR, and Dreams is a program for adolescent girls and young women ages 10 to 24. And Dream stands for Determined, Resilient, Empowered, AIDS-free, Mentored, and Safe. And so my charge, there were 15 Dreams countries, and my charge, I was assigned to a couple of countries to and let me actually just back it up. So dreams, the whole point was there were countries that were identified with very high incidence of HIV. And so this project came to be is how do we create a multi-layered, multi-sectoral, comprehensive package of evidence-based interventions to address the high incidence of HIV among adolescent girls and women in these 15 countries. And so my part was to lead the effort in a few of these countries. And I will say, there's so many challenges in this work. We were working across an interagency space. So there's USAID, there's CDC, the State Department of State, and working together to actually complete this body of work and to do it in a timely way. So whenever we're doing evidence-based interventions, that takes a lot of time to implement, particularly in settings where that work wasn't done in the first place. So now we're talking about adaptation. We're talking about assessing resources and constraints and community mobilization and engagement. Like, how do we actually implement these interventions that were efficacious in one region, but yet we're trying to implement in this region and do it in a timely way with limited resources. So I say, this project, there was economic strengthening, family strengthening. So family strengthening was parenting programs to talk to kids about sex and sexual health and safe sex. So there's that part. There's educational subsidies, voluntary testing and counseling for men, violence prevention. So it was really a comprehensive package that really involved a lot of sectors. So I said, so I think going back is the question of how do we do this? Fidelity versus feasibility. Fidelity is did we implement this intervention as we had intended to, based on what the data had initially showed? And then there's feasibility, and feasibility already always trumped fidelity because it has to be sustainable. It has to be able, it has to be done in the setting. Is there the staffing? Is there the resources? Is there time to do this? So these are all questions that we're faced when actually having the charge to or taking the charge to implement these interventions. Trying to think about some other lessons learned in that space. No work can happen without community engagement. And we worked with the Ministry of Health, partners on the ground. But if we had selected an intervention that we thought would really work well, and we thought, okay, well, these are ways that we could adapt it to make it linguistically and culturally appropriate in this area. If there wasn't support from the people on the ground, it just wasn't going to happen. And if you were going to shoehorn that intervention, there was not going to be success. And in one case, that actually happened, not under my watch, but it happened. And it just, there was no success. So you invested in adapting this intervention, but it was not sustainable and it had no community support. And if your community doesn't support it, they're going to undermine the whole work, the whole body of work. So I think those were some lessons learned and some challenges that we had to face in the field. But again, feasibility trumps fidelity. And I think as scientists, we're always like working like, wait, it's got to be just so, and it has to be implemented as such. And really, you're not going to get anywhere with that attitude. So that's what I had to learn very quickly.
Yeah, I mean, and that's such a great lesson, to impart on to a lot of people who are interested in working in this field. And especially in your role as adjunct professor at Emory University, you mentored the next generations of public health professionals. What are some key lessons that you emphasize to your students, particularly those that are interested in epidemiology, behavioral science, global health? And what advice would you like to offer to those who are looking to work in this field?
So it's a really good question because I think how I mentor has shifted over the years. It's certainly, there's always a bi-directional relationship with any mentee, but I think um, I use this term a lot. I use it with my colleagues. I use it at home, but more connection and less correction. Uh, a lot of the relationship that I a lot of the relationship is just built on that trust and that rapport, and trusting that your mentee will come to you if they need anything. And it's just really drawing on curiosity and asking questions and supporting where it's needed, but not over advising.
Mm-hmm.
Or trying to drop those pearls of wisdom that we tend to drop or want to drop because we don't want them to have to go through what we've gone through. But so those are that's been more of my approach of late, is just allowing the mentee or the student to be able to share some of the challenges they're facing either academically or with their projects, and really maybe providing a little bit of guidance, but really that the answers are within. And how do you harness that? And how do you empower them to identify what those solutions are? In terms of, and then repeat and I think this was a two-part question. Repeat your second part of the
Yeah,
question.
basically, just like what advice would you like to offer to emerging public health professionals who are interested in working in, global health, in public health, and HIV prevention, etc.
Yeah, I say there's a lot of opportunities out there. I think anytime you join a program, if you know from the onset that that's an area that you want to pursue and really develop skills in, then make sure that you really look into the program to see if there's a good, maybe at least one person or a couple of people who are doing work in that area, so that when you're there, you feel supported. So I would say that happens before they become students
Right.
at that graduate program. And then once they're there, just actively pursuing your interests. I think I did it because I was soaring like an arrow into the abyss. I really didn't know how to get there. I knew I wanted to get there, but I didn't know how. I didn't have the tools. But I think that was also a different time. I think there's so much information at your fingertips now. And
Hmm.
I think there's ways to navigate that before you even arrive to the program. So I feel I'm being schooled sometimes by my students, and I love that. I love the bidirectionality of it. I think I told Samir earlier, I love working with intergenerational teams because I learn so much from them. And
Yeah.
hopefully they're learning a little bit from me in the process. But I say in terms of specifics around HIV, global health, I don't know that I have specific advice, but
Hmm.
I think that this generation is extremely resourceful and they will find a way that
Yeah.
I've not had to like show them the path or give them advice. They make it happen. It's just a really different cadre of public health students, particularly in the last 10 years.
Yeah, that's a good point.
And Shilpa, I honestly, and I'm sure our viewers are going to feel the same. We could listen to you talk for hours. I mean, such great ideas. I'm thinking about all that you've said, data to action, how community members, I mean, they're the ones who are the experts and they know best what they need. And so we as researchers just going in and this top-down approach versus, this co-creation of knowledge, if you will, your idea around feasibility versus fidelity. The mentorship piece again was very inspiring to me in terms of, the rapport building process and more connection, less correction. That was, I just made a note of it because it was so profound. So thank you for sharing all of that. And just in closing, we'd like to ask you, given your experience with SAFA and your really very impressive and extensive background in global health, because that piece about making those connections across the globe and how the UK, even Canada, Australia, they're doing such amazing work in public health. I think that was very profound as well. What closing insights you can share about advancing health equity within South Asian communities?
I I think just I'm going to go back to what I shared earlier, which is just partnering with folks and not feeling alone. I think we work in silos. I think we continue to work in silos when we know that we work better together. And I think part of it is, well, if I work by myself, then I just have to kind of contend with my own thoughts and my ideas and my small group's thoughts. But I think that we can leverage and strengthen our methodologies, our approaches to research, our ability to disseminate findings in a way that is actually effective, that will actually turn that data into policy and actionable programming and so much more if we work together. But I think really becoming a little bit comfortable with discomfort and putting ourselves out there. As researchers, we're trained to investigate and to do a lot of things on our own. And I know we work in teams, but I found academic research in general to be very isolating, very siloed. So I say, I go back to that, that point about partnering and building coalitions, whether it's in your institution or uh, in the state, across the country, however you want to do it. But I think we're better together, and I think we just produce just better work if we move in that vein. And going back to data to action, I feel so strongly about it, and really coming up with a plan from the beginning so that you can carve out the funding, because data to action is not, it's there is an expense tied to it. Going to communities and returning those data to communities, or engaging them in creating an actionable plan, that requires time, effort, and it requires money. And if there's ways that it can be incorporated in the work that we do from the onset, then at the end, we're not like trying to, get supplemental funds or trying to make it work with the little funds that we have. Um, I know that's not always feasible, but I think also talking to funders who haven't seen this work, or this these set of tasks as part of their typical funding package. But it's also equipping them, knowing, the value of data to action, and what it can do for communities, and how those data can go deeper into communities. Um, I think also sharing with that, and, maybe educating a little bit of who the people who'll be in the position of reviewing a grant, equipping them with the knowledge, that when they see your grant, that they'll see this, and this is the reason why. There's opportunities for that. I'm just trying to think off the cusp, and see how I might be able to, um, if there are other insights, but I think those are the two pieces.
Yeah, I mean it's very helpful to hear that. And, I think a lot of you've given us a lot of great thought, food for thought, and like materials to just go back and think about and see, ways that we ourselves can implement this within SAFA, but also I'm sure our viewers, our listeners are probably sitting there thinking, oh yeah, that sounds amazing. Like I want to be able to do that. And it's been very inspiring hearing you talk. So I just wanted to, thank you, Shilpa, for taking us on this incredible journey through your experiences and insights. It's been an honor to have you here as our guest on the SAFA Spotlight series. And to our listeners, thank you for joining us on this milestone episode. Stay tuned for more conversations with past SAFA board members as we continue to explore the career progress of individuals who have paved the way for change within the world of South Asian public health. Follow us on YouTube and Spotify by subscribing to our channel. And if you enjoyed this episode, please consider donating to SAFA at www.safa.org. Until next time, this is Samira and Mashira signing off. Thank you so much. It was great having you here.
Thank you.